Thank you, Chair Baldwin. It's great to have our first kickoff hearing. Appreciate your leadership. We've worked together in the past. There's no reason we can't do that here on the Labor HHS Subcommittee. And so we've both been on this subcommittee for several years, and I know we have a great vision. Speaking of new roles, I would like to take a moment to recognize the Senators Murray and Collins, who are the new chair and ranking member of the full committee, and vice chair. Senator Collins is the vice chair. They are committed to returning to regular order to write and pass appropriations bills in a bipartisan and timely manner. I wholeheartedly support this approach, and this budget hearing is a necessary first step for the process. Secretary Becerra, we served in the House together. It's very nice to see you, and thank you for your communications with me. I appreciate the give and take. This is an important opportunity for us to hear about the HHS budget proposal and better understanding the priorities. First, the success of our process depends on finding common ground, as our chair just enumerated. Unfortunately, this budget appears to be another bloated partisan request that simply spends too much money after the record level of spending that we've seen over the past few years. Simply put, the budget should not be enacted. I don't think it will be. We can't afford to ramp up base discretionary spending by a whopping 13%. At a time when we should be looking at common goals to improve the health of Americans across the nation, the budget further wades into polarizing issues such as repealing the Hyde Amendment, proposing additional flawed climate change activities, doubles funding for controversial gun violence research, and increases funding for family planning by almost 80%. But I'm really disappointed not about what was included, but what wasn't included. Programs and activity that typically enjoy bipartisan support receive little or no attention in this budget and are flat funded. For instance, there are no new resources specifically for Alzheimer's research at NIH. The CDC's Alzheimer's activities, nor the Administration for Community Living Alzheimer's Disease Program. I would note in the audience today, we have a lot of Alzheimer's advocates, of which I am their great champion, and one of their little signs said, more time. I wish I'd had more time with both of my parents as they suffered with this horrible disease. Similarly, the budget stalls funding for the Children's Hospital's graduate medical education program and diabetes prevention. We have a huge problem with diabetes throughout the country, particularly in our state. And I was surprised to see that the budget yet again requests mandatory funding for pandemic preparedness and response. As our nation thankfully moves past the COVID-19 public health emergency, Congress will now need to better understand how HHS is ramping down programs that received emergency supplemental and mandatory resources to avoid funding cliffs in the future. Not only that, but the subcommittee also has a responsibility to provide oversight and ensure accountability of the federal dollars that have already been spent. A new mandatory program is basically a non-starter. That being said, there are a few notable areas of the budget that address important national priorities that will have to be explored in more detail. One of these is a focus on biomedical research, which the chairwoman talked about, that has long enjoyed bipartisan support. The budget devotes significant resources for the third year for the Advanced Research Projects Agency for Health, better known as ARPA-H. Additionally, the budget proposes additional resources for the Cancer Moonshot, a cross-cutting initiative that touches several HHS agencies, including CDC, CMS, and the National Cancer Institute at NIH. Far too many of us have been touched by cancer. West Virginia, my home state, is especially hard hit, ranking above the national average in both new cancer diagnoses and deaths. Substance abuse challenges continue to face the nation, and I don't think have received enough mention in this budget. While the budget repeats many of the unattainable funding levels for substance abuse programs from the previous 2023, the White House budget's overview rarely mentions fentanyl or opioids. My home state has been in the crosshairs of this opioid and addiction crisis for several years now. We continue to lead the country in overdose deaths per capita. Since fiscal year 2018, the subcommittee has increased resources towards opioid prevention and treatment programs by more than $4 billion. I know we need to shape the programs we've got, so I want to know how these funds and programs are moving the needle in the addiction crisis. Without a doubt, our jobs will be challenging, and your job is very challenging, given the economic and financial constraints that we find ourselves in. It is my hope we can come together in a responsible way to find areas of efficiencies and focus in these areas of government. And thank you again for being here.